I am Ashley George, and I'm going to mute my side combo. I am the executive director of the Charlize Theron Africa Outreach Project, CTAOP. We are so excited for today, pumped for this conversation, grateful for everybody who was able to join us. I know we are recording the conversation too, so we're planning on sharing it for anybody who wasn't able to join us today. For those of you who don't know CTAOP, we are a foundation that was founded 16 years ago now by Charlize Theron, and our mission is to advance and invest in the health, safety, and education of young people in Southern Africa. And even after all these years of saying that statement, I feel like the one thing that I always feel like doesn't come across in our mission statement is really our heart and soul, which is our program partners. And the program partners are why CTAOP exists. They're a group of extraordinary organizations, community-led, community-based in Southern Africa that are doing just exceptional, impactful work with young people. And it's our honor at CTAOP to be able to partner with them and to support them with grants and wraparound support and convenings and opportunities to amplify their voices and stories, which is why we're here today. So I'm really excited to be with Amandla Development. I'm going to turn it over to our moderator here. We do have, just a note, we do have the Q&A open. If questions come up, feel free to pop them in the Q&A to us. If we get a chance, then we will throw them to the group. We'll see how I know it's morning and we're short on time, but see what we can do. And with that, I'm going to just turn it over to Jackie Nichols, who is more than a friend to CTAOP, a longtime supporter of CTAOP family, and one of our Yebo Leadership Circle members. Jackie?
Thank you, Ashley. Yeah, my name is Jackie Nichols. I'm so excited to be here. As Ashley said, I am a proud CTAOP supporter. I've been fortunate enough and privileged enough to get to work with CTAOP for many years now. I am calling in today. I'm traveling. I'm calling in today from New York. But enough about me. This isn't about me, thank goodness. This is all about shining the spotlight on a wonderful program partner, Amandla Development. I've had the honor of actually being able to work with Amandla a little bit. So I'm really excited about this conversation. And with that, I want to just kick this off. Maybe Scott and Tauna, you can both introduce yourselves, talk about what your role in Amandla is, and where are you joining us from today?
Okay, so I guess I'll start. My name is Scott Clark. I am the founder and director of Amandla Development. My role is, I would say, high-level strategy and fundraising, as they say. But honestly, I feel like a lot of my role is listening, and just really trying to learn as much as possible about what's actually needed in the community. We'll obviously get into more detail about our strategy as we go, but a lot of it is building relationships and listening, and that's where I primarily focus my attention. And a lot of that listening also comes to Tauna because he's way smarter and capable than I am. So I'll just segue and let him introduce himself.
No, thank you, Scott. So my name is Tauna Tsopo. I'm joining from Cape Town in South Africa, right in the heart of Philippi, as I'm having this meeting within our program interventions area. My role with Amandla Development is program manager and is strategic support for the team, mentorship and coaching, ensuring that we are inclined to deliver on best practices regarding our programs, being informed by the data that we collect through our programming cycles. So basically, I think that's what I exist for within Amandla.
Excellent. So glad that you're both on this call with us today. I think for some people joining us, this is the first time they're hearing of Amandla. So I think it would maybe be good to start with Scott. Maybe you can start, and Tauna join in as well. If you can talk a little bit about Amandla's vision today and how it's evolved over time.
Sure. Yeah. So, I mean, our vision today is making sure that every single young person in the community is fully supported. We primarily want them to be able to finish school because that obviously opens up a wealth of opportunities for them in terms of their career and just being able to be an active citizen in their own community. But a huge chunk of that vision is bringing together the other organizations who work in the community, because one organization can't do it alone, but also, everybody kind of has to have that stake. And, I feel like if we all have our focus on the success of the young people, then that by itself, is a win. In terms of how it's changed since it started, it has evolved tremendously. I think the vision originally was, it was basic education. Let me just put it that way. Right now, it's everything, it's education and everything surrounding it to make a person's education possible. But I think originally it was just sort of, I used to work in university admissions, and I would just see in, sort of urban communities, poorer communities, that those young people hadn't at all been prepared, to move on to further study. And there were so many programs for high school students, but it just struck me that they were getting to high school with massive deficits. So my original thinking was, okay, how can we, cure some of those deficits early on, early childhood literacy and that kind of thing. But sort of the further back I moved, the more it became, you've got to start with maternal health, and then, nutrition at a very young age. And then those things weren't related to school. So it just, sort of grew from there to be throw the kitchen sink at the problem, because that's truly what it actually takes for someone to grow up healthy and able to learn and thrive.
Great. I wanted to start with that because I think it's important to understand kind of the evolution, but I think it's also equally important to understand the community, right? That you touched on that a little bit, and how that's influenced that evolution of the vision along the way. And I actually had a question, I wanted you guys to paint a little bit of a picture of Philippi for us, the community in which Amandla operates. But I want to we received a question, so I'm going to jump right in with a question because I think this is very telling. I think this is, a lot of people on the call today haven't visited South Africa. So I'm just going to read this question and let you guys answer this. The question that was sent in by someone is, my little brother Daniel went to South Africa and studied at the Madrasa, apologies about the pronunciation there, outside of Johannesburg. One of the things he told me was that there was so much violence in South Africa that every corner store had an armed guard carrying a machine gun. I'm not sure if he was exaggerating, but it does seem like South Africa has its share of violence. Growing up, I experienced a great deal of violence and know how that can have a big effect on a person's outlook towards society and self-worth. So my question is, what type of things does Amandla do to help mitigate these experiences for youth in South Africa? So that's the question. But it's really, if you could help paint that picture of Philippi as well, where you are operating.
Yeah, I'll let Tana start on that.
So, that's quite a question. I think that an experience you are most likely to come across if you visit some parts of Cape Town. So our market development exists to try and ensure that there's safety in our communities, and we do that through quite a number of issues, because we've realized that our data collection process and our surveys and research, which informs the design of our programs, speak to that safety is an issue. And as I'm sitting here, I think for the past week, we've gone through quite a series of burglaries and at our office. So that's kind of like explains exactly the type of environment we are working in. But what Amandla has done is that we are so engraved in the communities that we work in, so that we understand what the challenges are, we understand what the opportunities are. In the midst of the violence that we speak about, there's great opportunity because we work within the communities. So we come up with homegrown activities or responses through negotiation and engaging and co-creating activities or programs that are meant to address issues of safety. So we have a number of working groups that we work with. So we have kind of like a working group that is meant to address issues to do with domestic violence and safety. So we work with the South African Police Services. We also work with the community policing forums. So in our working group structures, which address safety issues, we meet on a monthly basis to share what data is talking to, and then we kind of like co-create logical frameworks to try and address the challenges that are coming through what our stakeholders and what our partners as well as what the communities are bringing to our attention. Yes, you realize that it becomes a safety, it becomes a concern that learners find it difficult to navigate their route to their pathways to school and back. Learners find it also difficult even to be in the school environment. And that has also been informed by part of the surveys that we do, a ready to learn survey that we conduct on an annual basis in August, where we are conducting such services, such research in 9 schools. So we do work collaboratively. We do engage with our partners. We work collaboratively. We work with the data that speaks to the hotspot areas, data that speaks to the areas that need to be addressed. We come up with, we create programs that are meant to address that. So Amandla works through a collective impact methodology. So SAPS is involved, or SAPS are the gatekeepers in the communities that we work. The community policing forums are also part of that. Then we also have working bus interventions in schools and communities to ensure that as learners are going to school, as learners are on the way back home, they are kept safe because they are working with the parents, they are working with people that have volunteered from the communities to try and ensure that learners have safe passage between schools and homes. Yes, safety is a concern, but we do work with partners, SAPS and other collaborative partners to try and ensure that safety is ensured for our learners and also for the communities that we work in. I don't know, Scott, whether you can add on to that.
I mean, just a little bit. I think I would just say, just to kind of paint the picture a little bit more. I mean, I don't know how much the individual who asked the question is familiar with sort of, I guess I'd just, call it apartheid spatial planning, where, the cities were, obviously much more prosperous, developed. Until 94, they were only white people were allowed to live there. And then Black folk, people of color were, sort of relegated to the townships. And Philippi is a good 25 Ks outside of the city. A lot of the structures are informal, so people are living in shacks, somewhat cobbled together. The roads are paved, but not always in the best of conditions. And, just when you think about what it means to live in an informal structure, Cape Town gets cold in winter. There's wind, there's rain, and it means that if it's raining outside, it's often raining inside. Indoor plumbing is not always something that folks have, meaning in that same rain and wind, you may have to go out just to use the bathroom, overnight. So the juxtaposition of incredible wealth in the cities, and then, the abject poverty that folks are living in the townships, it's stark. And I just think it's important to realize that, crime and violence are often symptoms, of a much bigger problem. But also to the individual's question, while we want to do as much as possible to eliminate gang violence and make the actual setting safer, it is really, really important to think about the psychosocial health of the young people. And that's why we have social workers on staff. That's why we spend a lot of time just working on self-esteem. A lot of our arts program is getting young people to talk about things they've been through. And that's often also the gateway, to, them getting therapeutic support. So I just wanted to paint a little bit more of the picture and just say, yes, it's a bit of an exaggeration that there are machine guns at every corner store, and crime tends to be, unfortunately, very heavily localized to townships that are under-policed. But if you want to visit, don't worry, you'll be safe. Because I do remember when I first moved to South Africa, I was told 2 places never ever to go were Philippi and Woodstock, and now I work in Philippi and live in Woodstock. I did not do that on purpose, but just to give just a little bit of context that we are worried, but it's relative, and you'd be safe if you visited.
Excellent. I think that certainly helps paint the picture. And Tauna, you mentioned a lot of points there that I'm going to come back to. But I wanted to just kind of call out one thing. Amandla actually works in the community that it serves, right? Now, is this a bit unique for a nonprofit to do? And if so, like, what are the benefits of doing in that model, for example, working so closely with the community?
Yeah, I mean, I guess I can just answer that from a high level. It is unique. We have about 60 partner organizations in addition to schools and others in Philippi. And I don't know, Town, I mean, we're one of probably, 5 or 6 that actually, has an office presence there. You can correct me if I'm wrong about that. And so it's really key to building relationships and trust. Folks are very accustomed to seeing organizations who sort of shuttle in and out, and that really makes it hard for you to understand what folks are dealing with on a day-to-day basis. And I'll confess, I don't, you know what I mean? I mean, there's a very big difference even with working in it and driving through it to spending time in people's homes and in their situation. But it has allowed us to build up some trust, that we are willing to spend our time there. And just, spend time getting to know people. I don't know if you have anything to add to that, Tony.
Yeah, I think that's what's unique about our programming and our presence in the community, because I think that has brought in a lot of buy-in and ownership to our programs, because communities feel that we are there for them, and we also feel that they are there for us in times of any crises. But I think the long and breadth of it is that it's unique because we are engraved there. And so once we interact on a daily basis with our communities, they get to know about our programs, they feel our presence, we understand the challenges, we sit and co-create on things that affect both us and the communities. So I think that's quite, it's fitting and unique for our programming. And it has made our programs sustainable because communities feel that we need to keep these programs alive because they see the benefits as we co-create together.
Right. I would imagine they feel a part of the process as well. So, and I would also think, and maybe you guys can correct me, but you're able to adjust your vision and adjust your planning based on what's actually happening on a day-to-day from a community perspective. Is that an accurate assumption on my part?
Yeah, absolutely. But I mean, Tony, you're more familiar with the day-to-day of the working group, so I'll let you talk about that.
So quite many times we are guided by what happens on the ground. And so I think what's so unique about our programming is that the evidence of what's presenting in the communities is what makes us respond. So with the many members of working groups that we work with who have offices in Philippi, but they shuttle in, like Scott has mentioned, their offices are out there. I think we still guide. We've become part of like a thought leader. We've become part of like a backbone organization because they rely on us more on giving feedback on what are the day-to-day happenings within the community.
Okay, and yeah, I know this is going to be a somewhat maybe challenging question, but I'll ask anyway. How have things changed in Philippi since Amandla has been operating there, would you say? Are there noticeable changes?
That is a challenging question because it's yes, for sure. Some of them good, some of them bad, to be honest with you. I mean, look, I would love to claim the credit for all the successes, but I don't think that's, true. So, I mean, look, I think that, sort of first and foremost, we really wanted organizations to believe that collaborating, using information and not just anecdote to plan, how they were going to try to improve the community. Those were two big and key successes. So organizations work with each other. They ask us for the data that we're gathering on the kids so that they can plan and figure out if what we're doing actually makes sense and direct resources. So that is a huge positive change. We are seeing a very large number of students coming through our programs, recommending our programs to their peers, and the teachers tell us it is making a very big difference in how much time they spend on, social issues, trying to find the kid help and counseling, trying to work with families where there's situations of abuse or children are, living on their own and heading the household. So, I think we've made life easier on teachers for sure. We have definitely seen a difference in the way organizations collaborate for sure. But since COVID, we've honestly seen a massive increase of poverty, and that has led to an increase in crime. And then on the flip side of that, some more positives are because we have city council and government representation in our working groups and as part of the collective, they're more responsive, they're hearing people, but they're also feeling quite, frustrated, by how much more difficult things have gotten since COVID. So, I think we took maybe 3 steps forward and 1 step back due to COVID. I wouldn't say we sort of regressed all the way. I think that because folks work together now, we do feel more hopeful, and it was sort of, okay, we can respond to this as opposed to sort of the community falling apart, post-COVID. So I think in a way we can't really see what it would have been had we not been there, but we have an idea. But yeah, things have gotten really rough, since COVID. A lot of people are out of work, and really deeply struggling. We've seen food insecurity rise, and I think some of this is stuff we're going to see over time. Our schools mainly remained closed during COVID. There was no online schooling. That wasn't a thing. And when you consider that our lockdown only ended officially in July of 2022, if you were in 8th grade or first year of high school at the beginning of COVID, and then now, you're basically what we call matric, a grade 12 final year, you missed high school, you missed secondary school, right? And then, we can see in our numbers, we'd worked really hard on getting women into maternal health care, in the first trimester, getting young people vaccinated. And we can see those numbers way down, way, way, way down, because people are unaccustomed now in terms of just habit of going to clinics for anything other than COVID care. That was not an option. We took over most of the antiretroviral therapy for folks who were HIV positive, but we're not a clinic. We're not equipped to do things like maternal health and obstetrics, right? So, yeah, I mean, we're hopeful, but we've seen some very positive and very important sort of milestone changes on the way to the ultimate change we want. But COVID has been a very severe blow for us.
Yeah, I mean, worldwide, right, across the board, but I can imagine, it would be especially hard if you're already starting kind of behind. I think, I'm a data person. You guys know this, right? Because we were working on a data project together. So I love data. Data can tell us a lot of things. But I think one of the things about being in the community are those kind of things that data can't tell you. It's just that sense, it's that energy from people. And that's really the feedback you can get, and the importance of being in the community, I think, is being just kind of getting those intangibles, right? And knowing that, yes, our work is having a difference because people's attitudes are more positive. That side of stuff is not, you can't really capture necessarily directly in data. But Tauna, I want to talk about the data a little bit, because you mentioned this earlier. And I'm fascinated with data, right? So how do you use data? What kind of data, first of all, do you kind of use and collect? And how do you use it to inform your decisions?
Yeah. So we kind of like co-created an output framework with all organizations, the 6 organizations that are in Philippi, which talks about the different services that they offer, and the output data that they have on those services on a monthly basis. We also have been able to co-create a mapping process to understand where are the different services concentrated, so that we'll be able to guide spread and equal distribution of resources should there be a need within the partnerships. So we do collect data that's primary. So that's very primary data, because we do send out our data capture, our research assistants into the 60 organizations and more to collect that type of data. So that data speaks to all that I've spoken about. The idea is that we want to understand the trends in terms of service provision. We also want to understand the aggregation and distribution of services within the communities. But we also do collect data from the schools, which speaks to nutrition and health, which also speaks to home environment, as well as safety and personal support that learners feel are offered. And so we also collect that data on an annual basis within 9 high schools. And that data shows us how readiness learners are and how they feel well supported in their school journey. But we also do collect secondary data from government departments, and thanks that we've been able to build very solid partnerships with the Department of Health, Department of Basic Education, so they do share kind of secondary data with us, which speaks to school enrollment, matriculation, which speaks to literacy and numeracy. So this data, we do presentations on a quarterly basis in our collective meetings. So the idea is then want to understand the trends, want to understand the gaps. We present this data so that partners do realize the gaps that are presented in the interventions that are being offered in the communities. So in that way, we kind of like forge for partnerships, forge for collaborative interventions, so that we avoid a lot of duplication and competition in regard to what we are offering. So that's exactly how we do. So we do offer this data in our working group meetings, which happen every month, but we also offer that data to partners every quarter. But we also do individual consultations with partners, especially for data that speaks to their indicators, so that they're able to see what the trends are. In that way, they're able then to decide how best to move on so that they can get better outputs, how best to move on so that they can better their outcomes regarding that data which we have collected. So we have also presented, we have also of late, I think we remember we have had this long discussion where we have been able to come up with a data platform. So the members of the collective network, which are a network of about over 60 organizations that we work with as a backbone organization, required of us to develop a platform where they can easily access this data, so that they will, in cases where we are not able to access them, to provide for feedback on what the data is saying, they can timely access it on our data platform. And then if they have any issues, or if they want to interrogate with that data, our M&E and data analysts are there to provide for that technical support.
That's excellent. And I just want to highlight this because to me, this is the best combination. You guys are on the ground, so you're using your eyes, your ears, and your heart. And then you're using technology, you're using data, and you're combining those to make some decisions about where to go. And you're also gathering data. I mean, you guys are a little bit humble about this, but you're collecting data from people who haven't been on the radar before. So we're actually getting some information about people who've been overlooked before and now are being represented in some ways and actually influencing the work that you folks are doing, right? Which is really tremendous. I mean, I've worked with you guys on your data. It's amazing what you're able to do there, and your quarterly reports are fantastic. Now, both of you have touched on something a little bit that maybe some folks on the call are kind of scratching their heads or they're not familiar with, which is this notion of a collective network. Can you explain that a little bit to us, Scott? What is that? What does that mean?
Yeah, for any Star Trek fans, just to relieve your worry, it's not like the Borg collective. They don't. Okay, so what it means essentially is, we have a complex social issue that we tend to talk about like it's one thing, that issue being education. And most of us, when we say education, we mean in school teaching. The problem, of course, is that if young people arrive at school completely unready or unprepared to learn, no amount of great teaching, is going to resolve their issues. And so we've just recognized that you need a collective of impact, essentially, right? To get to the ultimate impact of strong education results, young people being employable when they finish school so that they can move out, and be economically active. So needing a collective of impact means we needed a network of people, important actors in the community doing all kinds of things. So we need the healthcare sector to make sure that young people are healthy enough to learn. We needed to have the, South African Police Service and other security groups like the Community Policing Forum to make the community safer. Because there are high rates of HIV, we need organizations who work in that space, maternal health, as I've mentioned, early childhood literacy, where we have some major gaps, mental health, sort of the list goes on. So we brought folks together into this network to say, listen, we have mutual accountability, but differentiated responsibility. We're not asking a nurse to all of a sudden, become a maths expert, right? But we do want the clinics to recognize they do have a role in keeping young people healthy enough to learn. The social workers, the schools, they need to talk to each other about what's going on with the young people. So our collective space is a space for people to talk to each other, to innovate, to make sure that what they're doing is actually relevant. And it's just so important to have government actors, nonprofit actors, all of the schools, active citizens who just want to be a part of things, because very often, our parents and caretakers are neglected. Again, coming back to that spatial geography, folks are traveling great distances to and from work. 25 kilometers may not sound like a lot to people, but when you're relying on, a very thin public transport network as we are, it's easily 2 hours each way. So how do you actually involve parents in school when they're leaving home at 5 a.m. and coming home at 7 or 8 o'clock? And that's very simple things like we can shift parents' meetings with schools till the weekend. We can get representation in other spaces. How do you make top-down policies, that are designed in our cities that are so different from our townships relevant to our townships? Well, you bring representatives into our working groups to talk to people, talk to the organizations that are often implementing those policies, and make sure that it's relevant in that space. So that's the notion, of a collective network. And then Tawana used the term earlier as backbone. Amandla serves as that backbone organization, sort of doing the coordination, making sure people have good information to act on. That's how it all sort of, works together.
Excellent. Thank you for that. How do you know, it's curious when you've got that many different relationships and, things going on, how do you know that you're being successful?
Yeah. One final nerd reference. It's kind of like Cerebro from the X-Men. You kind of have to reach out and touch all points.
That's exactly what it sounds like.
Thank you. Someone gets my references.
I got the board one too, just so you know.
Okay, fantastic. Well, I have a whole Thundercats one that would blow your mind too. But anyway, so and Voltron, those are okay. So we, it's touch points in the community through staff, like through Tawana, through other people that are constantly out there that get to know people. At the schools, they talk to young people. We have very specific touch points through our working groups and forums where people are, encouraged to just come and tell us about their experiences. We're super intentional about relationships. I think that is very much our secret sauce, that none of this works without that. We have seen in other parts of the country where people have tried to sort of do similar activities to us, but not have pre-existing relationships, they tend to fail. Our safe spaces, which we haven't really talked about much here, but that are very, very important for our programs. They work because we have organizational partners who trust us to come in and be very transparent about their successes and failures, and then because community members know who we are and trust us. We have seen other organizations across the country say, we're going to build a safe space, we're going to offer these 5 services, and then it doesn't work. You know what I mean? Because they just don't have those pre-existing relationships. So, just being out there as much as possible and getting to know people as much as possible, that is absolutely vital.
Tawana, were you going to say something?
Maybe also in addition to that is how we really get to know that we are on the right trajectory is that all the working groups that we work through, like for instance, Scott mentioned that you need health, so we have a health working group. You need safety issues, we have a safety working group. You have a GBV working group. You have an early childhood development working group. So we have quite different themes that we work to resolve. So what we do is that we co-create logic or frameworks or theories of changes in those working groups. So over time, we would have agreed that this is how things are, but where do we want to get? So having look at where we want to get by the end of the year or 2 years. So our logical frameworks maybe and theories of change for each working group span for about 2 years. And so we agree on who is doing what in that area to reach the ultimate goal, to the overall goal of the working group. So we kind of like split activities which we can implement individually, but we also have collaborative activities which we can implement together. The idea is that we have a shared measurement process and a way of holding each other to account as members of the working group. And that's how we also then find out that as we hold each other to account, we are also providing support, technical support to each other. We are also identifying gaps within our different interventions and programming. And in that way, we carry the weaker brothers with us for certain areas, and they also carry us with them for areas that we're not doing so well. So in that way, we usually are able to go through the destined goals of our work because we hold each other to account and we have a means of sharing the measurement process.
Yeah, that's wonderful. That's wonderful. I mean, I'm just looking at the time here. I've got a couple of questions, and I really want to give you both the opportunity to showcase. If we could hear from both of you, what is one thing that you're extremely proud of out of everything that you've done at Amandla that you'd like to highlight today for us? Tawana, let's start with you. Let's start. One thing that you've done throughout Amandla that really stands out in your mind as being a success or just having that impact.
Yeah, I think one thing that I've been able to do at Amandla is provide strategic thinking and guidance to the team. And the fact that we have actually experienced the benefits of our programming. You know, it's good to see learners get employment, complete their education and get employment. It's good to see HIV positive learners get on treatment. It's easy to see that we have had an impact on teenage pregnancy, on GBV, and we have also created economic opportunities through our programming. So the fact that you see these testimonies from the beneficiaries and you see them in the communities and you see the change process actually taking place, I think that gives me a lot of excitement and the energy to keep doing the things that we're doing.
Yeah, I'm going to share more than one, but I'll be quick. So I think the first one is, I noticed that most of the time when we see some sort of testimonial from a young person who's been part of our programs, they'll talk about the technical aspects, I got tutoring, my grades have improved, but they'll always sort of cite a specific team member where they'll say, like, this person's like my mother, this person's like my brother. And I'm so proud of the fact that everyone who works at Amandla brings heart to their work and really, really cares about the young people they're working with. I mean, that's just so extraordinarily important because, young people can sense it. You know what I mean? They know if you care. So I'd say that's one. Two, I think Tana somewhat touched on it obliquely, that it's amazing to me to see people who live in Philippi also now working for us, who maybe started as a volunteer, who are buying a home. You know what I mean? Because that means the ripple effects of what we're doing is now not just in schools, it's influencing the economy. People can actually experience prosperity. And I just feel like so often nonprofit work, folks are funders in particular, are just sort of looking for lowest common denominator when we want everyone to have a good life. Not just an adequate, not just a hand to mouth, but a good life. And so the last thing that, I don't think we're quite there yet, but it very much is our goal, is to just cast a completely different vision for development work. I'm 100% not satisfied with tinkering around the edges and sort of mitigating problems. We always talk about poverty alleviation. Why don't we talk about poverty eradication? Why don't we talk about completely ending HIV and AIDS? Completely, not just medicating, but completely ending it. And that's what we're trying to do. We're just trying to completely change the way development work happens, that we embrace complexity. We understand that there are no simple solutions. We understand it's bloody expensive. The whole $1 a day thing. I mean, would you try to raise your child on $1 a day? And so we need to just think about this work completely differently. And I would say that, again, while we're not there yet, I am proud of the fact that we are starting to change the conversation. And that is very much one of our major goals for the next several years, is to change the conversation. So if you're listening to this and you're an amazing communications specialist, come work with us. That's my pitch.
Excellent. It's actually, I was going to ask you, what does the next year look like for Amandla? I know you're talking several years out, but if we're looking short term, we know how quickly things can change, right? And we're still recovering from the pandemic. What does the shorter vision look like for Amandla?
Yeah, I mean, I'll give her two quick things that's slightly technical one, and I'll let Tana talk more about programs. I mean, we have grown really, really rapidly. We're reaching about 50,000 young people per year right now. In the next year, we certainly hope to push that up to at least a good 60, 70,000. And in, the following year is 100,000 in Western Cape, and then really moving into other provinces, because we just feel like we have so much to offer. So in the next year or so, it's kind of programmatic growth. But then, nonprofits, we're expected to make miracles. And so this is sort of the nitty-gritty response, is in the next year, we need to fill out our management structure. We need to be able to support our growth on the technical side. I want healthcare for all my employees, something that no funder will ever fund. We need to really up our communications game and tell our story. We have a great story to tell, and we need to be sharing that outside of South Africa. We want to share it within our community so that everyone understands, the real benefits of working together. So that's really what the next year looks like for us, I hope, is telling the story, just becoming a strongly managed, really well-run organization, even from a technical side. And then, Tana, you can share anything you want about sort of, reach and programmatic goals.
Yeah. So I think how we working is that we work through we provide tailored layered services to our beneficiaries. So we have been doing so well with regard to the psychosocial and social behavioral services because we have a pool of social workers. So mental health, grief counseling, and all that are offered in our safe spaces and in the schools that we are. What we want to see more, which we have started now this year, is the clinical aspect. Because I think we do have working groups, but I think we need to move a step higher regarding directly providing for clinical services in our safe spaces. So right now we have one of our safe spaces that is offering clinical services, and we want to see that grow so that all the 5 safe spaces that we currently have do offer clinical services, pap smear, and I mean, we're talking about HIV testing, pap smear, antiretroviral therapy, and all that. And the good thing is that the Western Cape Department of Health has bought into that, and they're providing for us now with reagents to do the tests, and as long as we can provide the statistics. And I think also like the top part of what we really want to see, employment, our youth getting employed, is what we would also want to focus on, the structural aspect where we are looking at increasing opportunities for economic opportunities for the beneficiaries that come through our programs. So currently we are doing a 4-day course, which is CV development, financial literacy, and skills analysis. We are moving into green energy fuel. I think we are very optimistic. Currently, we are looking at there's an opportunity in solar mounting as well as solar installation, and so we are looking at that being part of our bigger plan in that economic and in that process of creating economic opportunities for our beneficiaries. And I think, honestly speaking, like Scott has said, we're also happy that I think in as much as we are looking at the challenges, but there are a lot of opportunities that we see in those challenges. And also the fact that we have been able to see staff, the Amandla's employees, starting with me, life changing to live a life that would want to see the beneficiaries that we are working with live. A lot of our beneficiaries have been directly employed. I think, Scott, we have over 40 beneficiaries that have come through our programs that are now directly employed by Amandla. That's good enough.
That's fantastic. All right. Last question for me. What do you need? What does Amandla need right now, and what can people do to help?
Sure. Yeah, I mean, so I think, yeah, right. I mean, I touched on it a little bit in terms of our management structure, but I mean, that is so important. I mean, you always get people saying, nonprofits are poorly run, da 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 da. Well, okay, help us be better run. You know what I mean? Like our growth trajectory, I mean, one of our board members put it together for us the other day, where you sort of see our growth trajectory doing this and our management structure doing this. You can't survive and you can't grow as an organization if you can't grow those things. And I know that that's the very unsexy side of things, and people want to know that their money goes, right to that child, but who feeds the child? Who does the social work with the child? Who keeps the lights on? Like, that's us, right? And if you want a well-run organization that can continue to grow, that's a need. And that can come through finances, but that can also come through skills. And I mentioned the storytelling aspect of things. Are you a web developer? Are you a social media specialist? Are you a researcher? We really want to start, getting into the space of doing research, action research on our work and publishing what's worked, what hasn't, so that can get out into the broader sector. We want to tell our story. Do you have a panel coming up that you want somebody to speak on, or a webinar like this? So, I mean, there are things financially that, we need, but then also there are a lot of skills that I know that folks come with that they could be volunteering with us and then helping us spread the word and tell the story. So, from where I sit, those are very much immediate needs, for the organization to really continue to grow and make the difference that we want to.
Fantastic. Thank you. I know we're right at time. I can't thank you both enough. This has just been I love talking to you guys. You know that. I think the work that you do is just so amazing and impactful. So thank you very much for spending this time with me. And Ashley, I think I want to hand it back to you to close out with any last minute thoughts or anything that you have on your mind there.
Yeah, no, I think the only thing I'd just say is so, Scott, Towna, Jackie, all of you, we're just so grateful to have you in CTAOP's family, and we're so proud to be a part of the work you're doing. And everybody who was able to listen in, you're part of this community too. Our hope is that we just keep growing it. I think once you hear from leaders like Towna and Scott, there's like no question about the impact of their work. And I know that the more chances we get to share your work, the bigger the community is going to grow. So thank you. Thanks for making time. I know it's getting late there. And thank you, Jackie, for being an awesome moderator.
Thank you so much for having
Thank
us.
you.
Thank
Talk
you so
soon.
much.
Great day.